Hi, Dr. Paul Carniol at the annual meeting for the Foundation for Facial Aesthetic Surgery here in New Orleans, Louisiana. And we have been discussing the latest innovations in facial plastic surgery and making people look younger and better. Here with Dr.
Hi, I'm Dr. Lisa Bunin from Allentown, Pennsylvania, and this has been a great meeting. One of the things that I think, Paul, that is so wonderful, and you moderate so many of these panels, you ask all these great questions and we can learn from each other so well. So, like, what do you do for this part of the face? What laser do you use for this kind of a problem? How many units of neuromodulator do we use and what are our side effects? We've been able to have such great conversations and learn from our peers and keep up with the latest in everything. This is a great meeting to be together on.
Absolutely. We brought together all these experts at this meeting, and we can learn and bring it back to our patients so we can give them the latest treatment, the latest technology and devices, and the latest innovations in techniques. Yesterday we had some live surgery demonstrations that were quite impressive. I was in the operating room then, and that was excellent. So it's been a great meeting.
Yeah, it has. And it's fun because you learn from each other so many different, and this is a multi-specialty meeting, so that's what's been great. But I do think that it's nice that we're able to impart knowledge to our colleagues. And you and I have both been speakers and doing a lot with this, so it's nice that we're on the cutting edge.
Absolutely. And we've discussed some of the latest non-surgical things, such as microneedling with radiofrequency, latest use of lasers, latest use of Botox, and other similar neuromodulators.
And also all of the new fillers that are coming onto the market and how we can use that together with our modulators to get some better effects. And I think things have changed so much over the years. I mean, you and I have known each other for a long time, but to me, it's amazing how when we started with some of these things, we only were doing filling a line or just, everybody just wanted to do their 11s here and they want to get rid of their nasolabial folds, but it's much more than that. The artistry is what's really important, and we think about global volumization now, and we're teaching on a whole different level. It really is about artistry, and when you have a surgery background, I think that helps us quite a bit in being better at assessing the patient and better at giving a more global aesthetic improvement.
I think absolutely. I think that in addition to artistry, you need to know the anatomy of what you're doing. You need to have experience in the area so you can get the best results, because you have to know that in detail so you know exactly what you're doing.
And that's what's so good about this. This meeting and this continuing education and us sharing with others is a combination of facial plastic surgeons, oculoplastic surgeons, which that's what I am, you're facial plastics, and we've even incorporated now some dermatology physicians who have another approach as well, and learning the latest techniques and also a lot of the off-label things is part of why we keep current with it. And it really does come down to the more understanding you have of the anatomy and the credentialing that we have makes us have, I think, an advantage in approaching all of the aesthetic treatments that you don't really get if you don't have that kind of background and training.
Well, I think you bring up some excellent points, and I thank you for joining me here.
This is great.
Thank
Always
you.
a pleasure.